Maybe you shouldn't be stretching a shoulder that feels tight and painful. Hey guys, my name is Tony Maritato. I'm a licensed physical therapist, and on this channel I help individuals who are dealing with shoulder pain and rotator cuff repair surgery get the information that they're looking for. So if you search YouTube for painful shoulder exercises, almost unanimously you're going to find a ton of stretches. Now the problem with stretching is you're flying blind when you're trying to stretch. You don't know what tissue you're stretching. You don't know if you're stretching the muscle, the tendon, the ligament. You don't know if you're stretching blood vessels and nerve endings. There are lots of different kinds of stretching, but a lot of patients will tell me, well, my shoulder hurts, and when it does, it feels tight. If I stretch it, it feels better. But maybe stretching isn't what's making the shoulder feel better. Maybe it's simply movement that's making the shoulder feel better. And there are different kinds of movement that allow you to generate the same pain relief response without putting stress through inflamed tissue. Now, I'm the first person to say that our tissue, and when I say tissue, I mean our muscles, ligaments, tendons, and bones, it responds to force placed upon it. Right? There's a simple saying, it's the SAID principle, S-A-I-D, specific adaptation to imposed demand. Basically, you become stronger doing the things that you do. And so when I'm looking at somebody who's dealing with shoulder pain, and we're going to use the most common scenario, what we refer to as insidious onset shoulder pain. We don't know why the shoulder hurts. I just noticed one day it started to hurt. It's progressively hurt more. It's not getting better on its own. Okay, so it's gone more than a couple of days. Maybe it's gone more than a couple of weeks. The shoulder pain is persisting. So what happens is our normal human response to pain is to guard, to tighten, to protect. If my shoulder hurts, I tense up. And that tension is perceived as tightness. And the natural response is, well, if I'm tense, I need to stretch. I need to pull my arm across. I need to do all these things. But we're doing it without understanding the mechanism of injury and without understanding what's causing me to experience that sensation. So, quick anatomy lesson. There are lots of structures involved in the shoulder. There are muscles. Muscles are contractile tissue. They lengthen and shorten. They have electric properties, chemical properties. There's tendon. Tendon is the white, thick connective tissue that goes from muscle to bone. There's ligament. Ligament connects bone to bone. There's nerve endings. There's blood vessels. There's lymphatic vessels. There's the bone itself. There's the cartilage that covers the bone. There's the labrum, which is additional cartilage within the shoulder joint. There are more structures than I can name in this video, and to blindly say, well, I'm going to yank or pull on one, structure, and it's not going to influence all of the other structures is kind of a novice approach to trying to manage your shoulder pain. So what I'm going to suggest is maybe don't listen to the advice that you see online. Maybe even don't listen to my advice, right? But I would tell you that if you feel shoulder pain and you haven't had the chance to get it assessed by a professional, consider simple movement as a way to manage the shoulder pain rather than applying a stretch. So we see the crossbody stretch, we see the doorway pec stretch, we see the overhead stretch, we see all of these stretches. But what I'm going to recommend is, without applying a stretch to the tissue, maybe some simple shoulder rolls, right? I'm rolling the shoulders up and back. Maybe some shrugs, maybe some squeezes, maybe a couple rotations through the upper arm just to kind of get the shoulder moving. Maybe that can produce the same pain relief. That can reduce some of the muscle guarding and contraction that you're experiencing without applying tension through the tissue that isn't ready to handle the tension. So guys, let me know what you think. Let me know if this makes sense. Let me know if you try it and if it helps you at all. In the meantime, if you have questions like this, go ahead and post them in the comments below this video. Subscribe to the channel, and I look forward to seeing you on my next video.